I'm Dr. Nicole Rankins. I'm a site director at a hospital in Virginia. And my story is one where I was sitting in the call room and I get a call urgently that we need you in OR1 now. So I go running. There's a private doctor who is in the operating room. She was doing a cesarean birth and she was an experienced physician. This wasn't a particularly complicated surgery, or thought to be that it was going to be complicated ahead of time. But there was some difficulty getting the baby delivered in the cesarean section. And it had been approximately 5 minutes that she had been trying to get the baby out and wasn't able to. And when I was called in, I was able to scrub quickly, get into the case, and help safely deliver the baby. And the baby ultimately ended up doing well. So it's such a valuable asset for our private physician partners to have an OB hospitalist in the hospital 24/7, someone who they know they can call in an emergency, someone who can come very quickly to respond to things, to be that second set of hands and really potentially help in a difficult situation. These things can't always be predicted. This wasn't predicted that this was going to be challenging or difficult ahead of time. So it's really fantastic that I was there and that we are there in order to step up and provide this help when needed.